I think to make your visits with your doctor as productive as possible, it's helpful to make lists on the issues you want to be sure to address with your doctor. It's always the most frustrating situation to your doctor is when you have a nice long visit covering all your lupus issues, and as you're walking out the door, you say, "Oh, yes, doctor, I forgot to mention I've been having crushing substernal chest pain for the last 10 days." And, so you need to, be sure you have all the important problems to be addressed during the visit. So it can be addressed and be prioritized in the appropriate way. So lists are good on what you want to address, but also on just what you think might be important symptoms. Because lupus is funny because it can do so many different things that the patients may not quite be sure what are important symptoms. So lists of symptoms just to run by the doctor. I had a funny headache and I couldn't see out of my eye very well for about a minute. But then it went away and I haven't had it again. So was there something neurologic going on? Does they need to have some neurologic tests? So I'd want to know. Even though the symptoms lasted 1 minute, it didn't happen again. So I want to know about funny symptoms and sort of an inventory of how well their symptoms have been doing since I last seen them. I always know which of my patients are school teachers because they have very neat little journals of all their symptoms with a rating of how each of their symptoms have been doing since I last saw them. They're my very orderly patients. I know exactly how they've been doing the last 3 months. So that's fine with me. So keeping records so that you can really fill in your doctor on how you're doing is a good thing.